Hey coders, did you know that chronic kidney disease, CKD, often comes with multiple comorbidities, each with specific coding rules? Accurately coding these conditions is critical, but why? Let's find out. Properly coding CKD and its comorbidities isn't just about following the ICD-10-CM guidelines. It also impacts hierarchical condition categories, or HCCs, and risk adjustment. HCCs are used in value-based payment models to predict healthcare cost. Chronic conditions like CKD contribute to a patient's risk score, which influences reimbursement and ensures appropriate resource allocation. Now, let's break down the key ICD-10-CM guidelines you need to know. When coding CKD and its comorbidities, always follow the ICD-10-CM guidelines. A key rule to remember is if a condition is listed with the term with in the alphabetic index, ICD-10-CM assumes a causal relationship unless the provider explicitly states otherwise. That means you don't need to look for a direct statement linking the conditions. The ICD-10-CM already makes those connections for you. CKD is a progressive condition where the kidneys lose their ability to filter waste from the blood. ICD-10-CM classifies CKD into stages 1 through 5 as well as end-stage renal disease, ESRD. Each stage has increasing severity. Unspecified CKD, N18.9, should only be used when the stage is not documented. For ESRD, N18.6 include Z99.2 for dialysis status. For kidney transplant patients, include Z94.0 to document transplant status. Encourage providers to clearly document the CKD stage on the date of the encounter and avoid conflicting documentation. Hypertensive CKD occurs when long-term high blood pressure damages the kidneys. ICD-10-CM provides specific codes based on the CKD stage. For CKD stage 1 through 4 or unspecified CKD, use I12.9. For CKD stage 5 or ESRD, use I12.0. Always code the specified CKD stage. This ensures compliance and reflects the impact of hypertension on kidney function. Here is an example for CKD stage 4 along with hypertension. Even though they are not explicitly linked in the documentation, due to the causal relationship, we can code these together. So the correct codes would be I12.9 and N18.4. When heart disease, CKD, and hypertension coexist, coding becomes more specific. The ICD-10-CM guidelines provide these codes. I13.0 for heart failure, hypertension, and CKD stage 1 through 4. I13.10, there's no heart failure, hypertension, and CKD stages 1 through 4 or unspecified CKD. I13.11, there's no heart failure, hypertension, and CKD stage 5 or end-stage renal disease. I13.2 is heart failure, hypertension, and CKD stage 5 or ESRD. When you are coding these codes, code the specific CKD stage and any heart failure associated with the patient in order to reflect a full clinical picture. Here is an example with CKD stage 4, hypertension, and CHF. To correctly code these codes, it would be I13.0, N18.4, I50.9. When coding diabetes mellitus with CKD, assign the appropriate ICD-10-CM code based on the diabetes type. Type 2 diabetes with CKD is E11.22. Type 1 diabetes with CKD is E10.22. The key difference between diabetes type 1 and diabetes type 2 is diabetes type 1 is autoimmune, little to no insulin production, usually diagnosed in childhood and requires lifelong insulin. Diabetes type 2 is insulin resistance or deficiency, more common in adults, managed with lifestyle changes, medications, or insulin. So if only diabetes is documented without specifying type 1 or type 2, the default is type 2 diabetes. So in this situation, along with CKD, it would be E11.22. So here's a documentation tip. Always code the specific CKD stage along with the diabetes code. For example, E11.22 and N18.30 for type 2 diabetes with stage 3 kidney disease unspecified. Here's an example where stage 4 chronic kidney disease is documented along with diabetes. The correct coding here in this example would be E11.22 and N18.4. Accurate coding for CKD and its comorbidities is essential for compliance, reimbursement, and patient care. Remember these tips. Always document the CKD stage using the correct N18 code. Code comorbid conditions together. Diabetes and CKD use E11.22 or E10.22 based on the type of diabetes plus the CKD stage. Hypertension and CKD use I12 plus the CKD code. Use I13 for hypertension, heart disease, and CKD. Also code the CKD stage and heart failure if applicable. For dialysis patients, use Z99.2. If it's a transplant patient, be sure to add Z94.0. Avoid conflicting or unspecified CKD codes. Encourage detailed provider documentation to ensure complete and accurate coding. By following these guidelines, you can support compliance, appropriate reimbursement, and high-quality patient care. Stay sharp, coders!